Insomnia patients, when they come to see us for evaluation, and remember, insomnia is the inability to get to sleep or stay asleep or wake up refreshed in the morning. And typically people who see us for this have been doing this for months to years. The initial evaluation consists of an intake, history, and physical that we perform, that I typically perform, getting the patient's complete medical history, talking to them about their sleep behaviors, and then we start the process of defining and outlining their overall sleep patterns and sleep behaviors as it relates to both the evening and during the day. And then we typically have the next visit is a follow-up 1 hour with myself and our sleep behavior team, where we start to go and take apart the sleep cycles or their sleep patterns, which we've defined by having the patients do what we call sleep logs. At that point, we come up with a personalized course of action where we try to start to modify the behaviors as it relates to both sleep and wake. Sometimes, not often, it requires medication, but not usually in these initial phases. It may require us adapting some of their medications and certainly their behaviors. So this is the initial way that we evaluate an insomnia patient.